Good evening, ladies and gentlemen. I'm going to talk to you about, is diet a risk factor for multiple myeloma? Now, we know that the patient with multiple myeloma presents to us with acute kidney injury. So acute kidney injury has been dealt with already in the first session. So I'm not going to talk about that management. It's a general thing that I'm going to talk to you about. And it is that I start with Hippocrates, the father of modern medicine, who said that cure sometimes, treat often, and always, and comfort always. Now, over 150 years ago, a 45-year-old London tradesman, Thomas Macbean, one day, while walking, stumbled, fell, and was seized with a severe pain in his chest. Over the course of 2 years, he was treated for recurrent severe pain with a variety of treatment, plaster to the chest, removal of a pound of blood, maintenance therapy consisting of application of leeches and later cupping and steel and quinine. Remission from this last treatment was, as was the case with all others, did not last long. Now, Mr. Macbean's consulting physician, McIntyre, recognized the features of Benz-Jones proteinuria, and when Macbean's pain recurred, he consulted Henry Ben-Jones, who erroneously concluded that the protein that precipitated when Macbean's urine sample was heated a little above 50 degrees centigrade and cooled was a hydrated deuterium oxide of albumin. Benz-Jones recommended that any patient with mollitus osseum, that is softening of bones, should be examined for this particular protein. Now, multiple myeloma, we all know, is the second most common hematological malignancy that is responsible for nearly 20% of hematological malignancy-related deaths and has shown a uniformly increased incidence since 1990. The median age at diagnosis is 69 years, with male sex, African ancestry, family history of hematological malignancies, and obesity being established risk factors for it. Now, in India, the incidence of multiple myeloma is stated to be 1.13 per 100,000 in men and 0.81 per 100,000 in females. Now, the common manifestation of multiple myeloma patients exemplified by the acronym CRAB includes hypercalcemia, renal failure, anemia, bone disease in the form of osteolytic lesion, pathological fractures, or diffuse osteopenia. Now, multiple myeloma patients typically present with complaints of fatigue and unremitting bone pain. Infections are a major cause of morbidity and mortality, and the risk of infection increases with active disease but decreases the response to therapy. Now we know that the clinical presentation of multiple myeloma is either in the form of cast nephropathy, interstitial nephritis, infiltrations, bowel lymphoma, MCD, MPGN, or and heavy proteinuria, and they present normally to us as acute kidney injury, and then we find that the patient has multiple myeloma. But I'm not going to talk about that. World of Cancer changed in 2005 with diet and lifestyle changes developed by Dean Ornish, which included 19 cancer-inhibiting vitamins, minerals, herbs, effective in halting and reversing the progression of slow-growing but potentially fatal prostate cancer. The new 4 basic groups that he talked about were fruits, vegetables, whole grains, and legumes. Now, he claimed that faster-growing cancers can be slow to the point that Ornish diet will stop them. This diet can be viewed as a 3-legged stool with each leg representing essential aspect. Take away one leg and the stool collapses. And the 3 legs are: no animal products, avoid fatty vegetable fruits, particularly nuts, eat only whole fruits, eliminate all added sugar and corn syrup, and sugar naturally present in the food is okay. So, is diet a risk factor for multiple myeloma? Diet may influence risk for multiple myeloma by modulating pathways for it, though the literature is limited. Now, this paper, that is Dietary Patterns and Risk of Multiple Myeloma in 2 large prospective US cohorts, was the first evidence of the role of diet with higher inflammatory or insulinemic potential in multiple myeloma development, and it was conducted on 69,000 females and 47,000 males between 86 and 2014. Now, the first, so they studied 7 diet pattern indices, and they said the subjects with high alternate healthy eating index, Mediterranean diet, DASH, and improvement pattern, which emphasized on higher consumption of vegetables, fruits, whole grains, nuts, legumes, long chain fatty acids, and omega-3 fatty acids, polyunsaturated fatty acids, and lower consumption of sugar-sweetened beverages, red processed meat, sodium trans fats, and moderate alcohol. They all tended to have lower BMI, higher physical activity, lower intakes of red and processed meat, refined carbohydrates, and sugar-sweetened beverages, and higher intakes of whole grains and fruits and vegetables. Now, this is what I've just shown you. Now, on the other hand, the Western pattern included the dietary index for insulin resistance, inflammatory pattern, and hyperinsulinemia, which emphasized more on processed and red meat, beef, saturated fats, creamy soups, margarine associated with hyperinsulinemia, and showed opposite trends in the general. And this is what I've been talking about. This is the table from the publication. So positive association of inflammatory pattern in men was consistent with hypothesis that immune modulating or pro-inflammatory factors influence multiple myeloma risk and were predictive of CRP levels, IL-6 and TNF-alpha. Dysregulation of endogenous growth factors such as insulin-like growth factor 1 and insulin also contribute to pathogenesis of multiple myeloma. So the insulin resistant diets and the hyperinsulinic diets, which were derived to characterize the insulinemic potential of diet, particularly related to insulin resistance and hyperinsulinemia respectively, and had positive association as risk for multiple myeloma. Now, if you have a look at this figure is showing you this one, where I've shown the red arrow, that cultured bone marrow mononuclear cells from multiple myeloma patients express CD138, showing that circulating insulin present in human AB sera could be partially responsible for the multiple myeloma cell growth activity of the serum. And then it was confirmed by adding increasing concentration of human AB serum, which increased the growth of myeloma cells. Now, this figure is showing you the highest 42% IL-6 serum levels in patients. And this one is showing you the IL-6 receptor levels in MGUS patients, and the controls the minimum, the maximum values. So systematic literature review, another publication, identified food patterns predictive of for individual sets of inflammatory and metabolic markers like high density lipoprotein and or blood glucose. So these are several food patterns. This is the summary of studies associated with inflammatory biomarkers and dietary patterns, which has shown that the vegetable-based and the fruit-based diets have, they do not have increased CRP levels. However, when you come across meat and processed food-based diets, then you have high CRP levels and IL-6 and IL-18 levels. So IL-6 and IL-18 had positive association with patterns high in red and processed meat and low in vegetables and fruits. And the patterns inversely associated with CRP concentrations were characterized with high loadings of fruits and vegetables, whole grains, or fish. And so this is the message throughout. And then diets based on bread also did not show any increased CRP levels. However, dieting was a very good study here, that adiponectin was high on dieting with low sugar, low fat dairy products, lasagna, low in butter and sweet condiments, because increased adiponectin levels, which is good, is associated with increased insulin sensitivity by improving glucose and lipid metabolisms. And healthy diets favored good inflammatory profile. And this table is showing you the different kinds of diets. And the message here is the dietary pattern indices promoting inflammation, insulin resistance, and hyperinsulinemia have positive association with risk for multiple myeloma. Now, on diet and nutrition as risk factors for multiple myeloma among Blacks and whites in the United States has shown that high risk for multiple myeloma was associated with intake of more than 1,200 kilocalories from foods per day and in overweight and obese subjects. And this particular table is showing you odds ratio for multiple myeloma in whites and Blacks according to consumption of food. And the message here is that the consumption of some vegetables had protective effect, and a reduced risk was associated with the frequent consumption of cruciferous vegetables. And with increasing intake of cholesterol, significant increase trend was of increasing risk was evident for whites. And with consumption of vitamin C from fruits and fruit juices, significant positive gradient was observed in the risk. So excess calorie intake and obesity may act as immunological responses that are involved in the development of this malignancy. And a meta-analysis of 10 prospective cohort studies has shown that an increase in the incidence of myeloma for each increase in BMI of 5 kilograms per meter square over 25 kilogram meter square of BMI is there. So we have to be careful with the weights. Now, cooked tomatoes, cruciferous vegetables, fresh fish, vitamin A had inverse association with multiple myeloma risk, and protective factor here in these studies was that fish contain a lot of vitamin A and omega-3 fatty acids. So was it the effect of vitamin A or was the effect of omega-3 fatty acids? It's still not known. Now, cream soups, jello, ice creams, milkshakes, and puddings were positively associated with multiple myeloma risk. And here you can see this is the antiproteinuric effect of omega-3 fatty acids, and we all know about this. Now, use of any vitamin was really good for in both the whites and the blacks, but use of vitamin C supplement was associated with reduced risk in whites, but not in the blacks. So this study, whole grain food intake and cancer risk, has shown that high intakes of whole grain foods consistently reduces risk of neoplasm. And for lymphomas and multiple myeloma, it is the odds ratio is 0.5. Now, alterations of gut microbiome accelerate multiple myeloma progression by increasing the relative abundance of nitrogen recycling bacteria. So there is an underlying association between gut microbiome and the multiple myeloma. I mean, you find gut microbiome working everywhere now. See that cardiovascular disease or progression of CKD. So it's everywhere. So metagenomic sequences of fecal samples showed a significant difference in bacterial composition between 37 patients and 18 healthy controls, and enrichment of nitrogen cycle recycling bacteria in multiple myeloma. A subsequent study by the same group showed that fecal microbiota from multiple myeloma patients, when transplanted into mice, showed significantly accelerated progression of multiple myeloma tumors. So where do this take us to when it comes to a CKD patient who is advised restricted diets? We've been hearing about this throughout. So where does our patient fit in? I mean, when he's on treatment, what do you give him? If plant-based diets are the answers to reducing risk and progression of multiple myeloma, patient already has multiple myeloma and is already being treated, then how do we address issues like hyperkalemia and hyperphosphatemia in CKD patients? I leave these questions to all the dietitians. They have to find an answer to it. So the take-home message of my talk here is the diet can have a preventive effect on risk for multiple myeloma. Diet with inflammatory or insulinemic potential may play a role in the development of multiple myeloma. Greater consumption of fish and cruciferous vegetables, fruits, whole grains, nuts, and less consumption of desserts and sweets, as in Mediterranean diet or the DASH diet, may lower risk for multiple myeloma and its progression. For good response to treatment, consumption of and insulinemic foods may be reduced, which is what I think. And underlying association between gut microbiome and multiple myeloma is definitely there. And supplementation with vitamin A and C can really help these patients delay the progression of disease. And thank you so much for your attention.